In tonight's Healthy Life, gum disease. You may have it and not even know it. Beverly Kidd has more on a breakthrough technology that could make your next visit to the dentist less painful.
That would be nice, wouldn't it, Patty? 60 to 80% of us have gum disease. Now there is a new laser promising to help fix the problem and make it more bearable.
It has been coming and going now for about a year. We first talked about this procedure about a year ago. And things progressed now to the point where I've got like 50% bone loss.
Like millions of people, Pamela Dahlmeyer started experiencing pain from periodontal gum disease. It got so bad, her dentist says she would eventually start losing her teeth.
We've been trying to get her to have her gum disease treated in the conventional manner. And now we have the option of treating it with the laser. And she thinks that sounds like a lot better idea.
Dr. Bruce Nelson says people like Pamela had shied away from traditional gum surgery because the procedure is often very invasive and recovery can be painful.
With conventional surgery, you're actually taking a scalpel, you're cutting the gum tissue away from the tooth, you're removing the gum tissue off the surface of the bone, and then you're suturing the gum tissue back together. I've had a number of my patients that have come in for laser periodontal therapy that have basically come in as the last resort. They said if the laser wasn't going to work for them, they were going to have their teeth pulled before they'd have conventional gum surgery again.
That's why Dr. Nelson is one of the 150 dentists in the U.S. using the FDA-approved perio laser procedure. It's a tiny laser. It does all the work, zapping away the infection.
And the laser goes into the pocket and it doesn't make an incision. It basically vaporizes the inside of the pocket lining. The laser very selectively just removes the diseased inner lining of the tissue, but it leaves the connective tissue.
Dr. Nelson says the laser helps tissue grow back on the bone, which in turn speeds up healing. It takes 2 hours on each side, and we're told the pain is minimal.
I just feel very fortunate that my dentist happens to be one that is able to do this procedure and has introduced me to it.
When I see the smiles on people's faces when they have it treated this way, they're happy, they're not having any discomfort, they're going back to work, they come in and they really thank me a lot for having it done it. They're so happy they did it.
And Dr. Nelson says he expects more dentists will start using the procedure within the next few years, Patty.
Whatever works and makes it less painful.
Yeah.
Thank you very much.